welcome to Inside Healthcare. We have a great program for you. A local doctor is joining us to tell you what you need to know about the #1 killer of women, and that's heart disease. We will also hear how young people can get help finding high-paying, high-demand healthcare jobs. And later in the program, the latest in fighting diabetes with a high-tech solution developed right here in Minnesota. But we begin with what you need to know about women and heart disease. And joining us, we're pleased to have back with us Dr. Carolyn McClain with the Emergency Room. Thank you for being with us again.
Thanks for having me.
It's always a pleasure to have you here.
Thanks.
So we thought with February being Heart Month that it might be a good time to kind of just review, bring awareness to heart disease in women. I think even in today, women may still be, and men, surprised that it's still the #1 killer of women, kills more women than all the cancers combined. What do people need to know about heart disease, especially women?
So I think you make a good point in that the healthcare community has done a really good job of getting the word out with cancer, and we have breast health, but our heart disease kills one out of every 2.6 women, and breast cancer kills 1 of every 30. So heart disease is still the leading killer of women, and women don't think about it like that. So I think we think about it as we worry about cancer, we take care of ourselves, but heart disease is something that's not at the forefront, and we don't expect to have a heart attack. So I think that's one of the big reasons why women don't come in and get checked out as frequently as men do.
But this is something that you see in the urgency room all the time.
Yeah.
Unfortunately.
Yeah. So one thing with heart disease, when you're having a heart attack, it doesn't feel like you expect it to. So people, when you see it on TV, someone's clutching their chest and they're having a hard time breathing. But heart attacks are more subtle than that. So what happens is, with women, women will have nausea. They'll just feel sick.
Nausea. How do you tell that's a heart attack, not just the flu coming on or something?
Right, so that's a good point. So one of the ways you can find that out is if you are having nausea or pressure in your chest or difficulty breathing, doing things that you normally have no problem doing. For example, walking up the steps. If you're walking up the steps and you're getting short of breath, and that's something you do every day, that needs to be checked out. And you need to come into an urgency room or an ER and have your heart evaluated.
And I understand that men and women tend to have different symptoms as well.
So yes, women tend to have more nausea, but in general, I think women just don't recognize it for what it is. But most of the time, people expect pain, and it's really a pressure on your chest. And it can go down either your left arm or your right arm. It doesn't always have to be your left side. It can go into your jaw. Women will just have jaw pain going up the steps, and that's an unusual symptom. And even sometimes they'll have neck pain and think that they pulled something in their neck. So
again, how do you tell the difference?
You really need to think about if it happens when you're walking or exerting yourself and not just when you're sitting still.
Or shoveling snow.
Shoveling snow is... Shoveling snow, if you get any neck pain while shoveling snow or difficulty breathing or any pressure on your chest while shoveling snow, absolutely come right in.
And are there certain populations that are at a higher risk for it, among women in particular, for heart disease?
So it's really important that you go see your physician so you know your risk factors. The biggest risk factors are high blood pressure and high cholesterol. But diet and exercise are critical to preventing heart disease.
That's what I was going to ask you next, is what are things that we can do to prevent developing heart disease in the first place?
Yeah, so there was a great study that came out of Health Partners, and what they did was if your cardiologist did everything perfect and managed all of your risk factors perfectly, they could only make a small dent in what you can do for yourself. If you have a healthy diet and you exercise, that's most of the battle.
And if you have a family history, that's important to know as well, because then you have a much higher risk in general than the general population.
Absolutely.
Go ahead.
Women will also present with heart disease slightly later than men, but having a family history of male heart disease in your family still counts as a woman. It's just that you tend to present later in life, maybe 5 to 10 years later.
And if you had a mother or father who had heart disease at a younger age too, I think that would also signify.
Absolutely, absolutely. So the main thing for women to do is to go in to see their physician, evaluate their risk factors, and there's a lot you can do for yourself to prevent this from happening to you.
And that means just getting up and moving, if nothing else. You
Exercise as much as you can, yeah. And that doesn't have to be really rigorous. You don't have to run a marathon. Just park farther out in the parking lot. You know, take a walk. Do as much movement as you can during the day.
Other things that our women should be aware of in their risk for heart disease?
I think the most important thing is awareness. Just knowing that if you have these symptoms, you need to come in and be checked out. So what we found is that women in general get less care for heart problems. And I think that's because women don't recognize that they have them. So if you are having any shortness of breath, nausea, chest pressure, you need to be evaluated.
And probably call 911 even if it's...
Absolutely.
Don't wait or drive yourself to the hospital.
No, don't drive yourself. I always worry when people drove themselves in and they're having a heart attack. I think, oh. But yeah, absolutely. It is completely reasonable. Sometimes people feel guilty about calling 911, but if you're having chest pressure, you should call 911.
Because you get the help right away in the ambulance
right away.
Before you even get to the urgency room or the hospital.
Exactly, and they can do an EKG right there when they get to your home. And so they can act, for example, if you are having a heart attack, they can call ahead and let us know, and we can get you care faster.
Wow, great advice. And then the urgency room, just for our viewers who aren't familiar with it, where is it and what is it and how is it different than an emergency department?
So we're essentially a freestanding emergency department, and we take care of everything from broken bones to heart attacks. And we are in Vadnais Heights, Woodbury, and Eagan. And we're open from 8 a.m. to 10 p.m. at night and every day of the year.
Sounds great.
Thank you.
And just final comments for our viewers, final advice.
Yeah, so
Come see you.
Yeah, well, I think it's just important to remember that women have heart disease as well as men, and that you really need to be aware of your risk factors. And if you have chest pressure, you need to come in to an emergency department or the urgency room.
Well, great advice. Thank you. And as always, it's a pleasure to have you with us. So thank you, Dr. McClain.
You're welcome.